Thank you, Brooke, and I really appreciate all the work that it has taken for us to get to this point, and welcome everyone. Mark has been great getting our WebEx set up, and Brooke has been a champion making sure that we get everything ready for today and for our next segment that will be coming up next month. So welcome all, and I want to talk a little bit about this whole idea of the use of motivational interviewing, which has really kind of hit a tipping point since it came upon the evidence-based practices website. The evidence base for motivational interviewing is something I will talk about just a little bit later, but to let you know that again, those questions coming later, we will really encourage you to talk about that. So a lot of the kinds of things that I want to talk about today have to do with this goal of increasing the knowledge of behavior change professionals, and that's what I call what people do in the helping profession. We are really interested in helping people work on change and work on changing their lives for a better outcome, and those better outcomes could be mental health, it could be physical health, it could be all kinds of things related to a person's need to make a change. And we have struggled for many years in change practices, if you will, to help people move from one part to the next, and sometimes people will make those changes and it'll seem like somewhat of a miracle. Well, there's a lot of research now that helps us to understand the technology around change, and that has been largely put in place by the use of motivational interviewing and how it does help people with behavior change. So I won't go into the history of all that kind of thing, because I think, although I might think it's interesting, it might not fit for our work today. So we talk a lot about health coaching, and health coaching, behavioral health coaching, whatever that is. We're looking for this optimum health piece, if you will. And so here are the kinds of things we're going to talk about: the basics of MI and its importance in creating a climate for change, talking a little bit about the steps of evoking change talk with your clients or patients, processes that promote successful change with those that you serve, and again, this evidence-based practice to engage and retain clients. And we'll follow up on this client ambivalence as a barrier to change. Now, just to let you know that we won't be covering all of this stuff in today's webinar. However, when we meet for the second time, this will be a complete agenda for us. So I wanted to make sure that you knew kind of what was up with today and for our next month's meeting. So if you're thinking about change, we've done a lot of things related to that. Having had previous education would be someone maybe persuaded to participate or complete their goals and objectives of a program. Think about diet change. Think about diabetes and the kinds of things we are concerned about with people who are having that whole metabolic syndrome of diabetes. We also think about, we've done some work with welfare and food stamps and people who are using the public money for survival. We've done some job training and things like that. And we always think that just because we're doing these changes and these trainings and things like that, that's going to affect change. Well, even think about the very seriousness of blindness and amputations and complications from other diabetes or other types of syndromes, such as substance abuse or mental health issues. The kinds of strategies that we've put in place would help people change. And we've come upon some of a conundrum because we still have a lot of health issues to address, health and behavioral health issues that are confounding us in terms of how much it's costing and how much, and not just in money, but how much it's costing in terms of human potential and human lives. So when we think about change, sometimes we have to look at the idea of, if you take a look at this landscape, what it might mean, and I've got here incorrect assumptions, that the incorrect assumption might be, if you look at this, it looks very, very differently from a different point of view. So when we're thinking about the change process itself, let's look at the issue of success versus failure. That people really, do people really want to change their behavior? Is this an issue that, in terms of, that our advice helping them really? Is it a good motivator for change? And I'm having to stop this. I'm sorry. I have to go back. Apparently, my automatic piece is happening there. So think about this. Do people really want to change their behavior? Sometimes we kind of throw people to the curb, if you will, when they don't change the way we want them to change. And one of the issues is that while they might want to change their behavior, there's a lot of other things going on underneath the process of change related to how they might go about that change. Advising optimal health as a motivator for change. Well, now that's another assumption that we make because we have a lot of information to share. We have expertise and we have knowledge and all of the kinds of things that that research gives us that is really helping us to help people move forward. But advice sometimes gets thrown back on those rocks we were looking at a little bit earlier. And then there's another assumption that we make that when we say lots of times people are either motivated to change or not. So why bother with people who aren't motivated for change? Well, in the terms of behavior change piece, we try to look at that motivation is not a dichotomous type of piece. It's more that it's a process than they're motivated or they're not. Sometimes a person's motivated to do something, one thing, and not the other when it comes to kind of a whole compendium of change. However, when change happens, it's almost like a miracle for a lot of people. So we've been studying that for a long time, and we've looked at how language is helping us to understand change in a little bit. So we want to say that MI is a tool for you in helping you tip the balance toward change, and it's really about that communication style. And what we want to think about here is that there's a strategic use of how we use questions and statements to help a person sort through their own particular reasons for change. So even though we have expertise and we have a lot of things at our fingertips to help people, we have to get them on board first. And part of that is this engagement strategies that is so fundamental to motivational interviewing and to just communication in general. So this method of communication that fosters change is built around a couple of things. One is this whole idea of being person-centered. And, we're seeing a big change in the healthcare and behavioral healthcare fields now when we come to look at person-centered communication. So I'm very happy about that, and that we're thinking about where does the patient, where does the client come from. And so one of the things that motivational interviewing helps us to do is to explore and resolve an ambivalence around a change process. And that is a particularly sticky wicket, if you will, when it comes to change, because it's this ambivalence that kind of rears its ugly head when we're looking at the change process for people. Also, that we want to try our very best to access a person's internal motivation for change. And this internal motivation itself is, how do we take something that's kind of pushing at someone from the outside, like a particular problem such as a mental health or substance abuse problem. Maybe it's a situation where they're having chronic failure to keep their blood pressure under control. That's another kind of thing. It's like, well, I do everything I can, but I'm not able to get it done. So we're looking at using this internal piece in terms of motivation for change. And then the last piece on that slide has to do with what we call empathy, optimism, and respect for choice. So this whole idea of autonomy is another piece. So client-centered, internal motivation, and a very respectful way of working with people. So we want to say that motivational interviewing is a powerful tool. And for your information related to that, this book, Motivational Interviewing, Helping People Change, is great. And what we're doing today is just a little taste of it. We're just basically doing a bit of an hors d'oeuvre. It's really not going to be our dinner plate. But the idea would be is that let's take a look at how it might fit for you. And if it does, great. If not, that's something else that you might want to decide to use to help people in terms of the change process itself. However, moving on to this way of understanding how we are using MI, is just make sure that you think about this as something else in the toolbox. It's not the end-all, be-all of everything, but it really can be very helpful for people in this change process and really exploring an issue around change and evoking the person's own arguments for change, which is critical in the work that we do. So it's this way of structuring conversations around change. We want to kind of try to stay away from calling it a technique, if you will, And one of the things that is really important in terms of some of the theoretical parts of this is that when people hear themselves talking about a need or a desire to make a change that's very important to them, that is something that's gives us very clear clues to why change has maybe not occurred or why a person might be struggling about it, about the change itself. So this speech that we have and this way that we're using motivational interviewing is to have a way of guiding the speech toward what we call the change talk, or advantages toward change. Then we also focus on a person's strengths, on what they may have had success in changing for in the past. But definitely we're having a conversation. So if you think about motivational interviewing itself, it's really a conversation about change. And it's, again, not giving people advice, not sharing them with our expertise, at least not until we have made a relationship with them and had a conversation about why change might be important for them. So we focus on, again, the kinds of things that help people think about and talk about and build what we would call personal arguments for change. In other words, what's in it for me? Why would change be something that would be helpful to me? So now when you take a look at this particular slide, it has to do with collaborative care and traditional care. And we know that this collaborative care model has really been making waves for the last at least 5 years, if not 8 to 10. But the idea would be is that we're assuming different kinds of things with traditional care than we do with this collaborative care process that seems to be making a big splash in our world today. And, you know, it's very interesting that the traditional care is kind of like quick and get with it and here it is, and then our collaborative care has a little more finesse or a little more process to it. So for a lot of people, it can be somewhat frustrating if they are so used to this traditional care model. The frustration is also that people don't actually make lasting change when they don't have a part in that change process. So the importance of the collaborative care piece is to make sure that we are thinking about where does the patient or client come into this. And in essence, we're shifting the process of care to have the client really make more of an entrance into their own care process. So if you're looking at this biopsychosocial model of behavior, and we're looking at the onset of chronic illnesses and the kinds of things that we might be looking at with any of those of you who are on the call today, this is just a good representation of all the different kinds of things that we are looking at for change. So again, this can be of all ages, well, mostly all ages, I guess I'd say, because we still have, you know, again, compliance issues with a lot of people when it comes to so many different types of behavior change concerns. So we are trying to move ourselves from thinking about a person being non-compliant when it comes to their illnesses to a compliance part where they are part of the change process and they are part of making the decisions around how that change works. So you can see where that might all fall in with the work that you are doing. So when we're thinking about what is distinctive to motivational interviewing versus what we're already doing, because, you know, if what I'm already doing is working, then have at it. And if it's not, then, and there's some struggles with that, then we want to think about how are we getting to that goal. It's nice to be able to just tell somebody and give them a pamphlet and here's what you need to do, but do they do it? And that's the point of having this, you know, conversation about change. So our way of getting to the goal is a little bit less direct, if you will, when it comes to using the motivational interviewing strategies. So the uniqueness to motivational interviewing is what we're doing in a conversation is that we have this intentional, differential, evoking, and reinforcement of change talk. I'll talk about that a little bit more in our second segment, but it's this whole idea of we are having a conversation that's not just a conversation, it's a directed and focused conversation about something. That we also are very strategic and directive in our use of what we call these client-centered counseling or client or person-centered methods, if you will. It doesn't necessarily need to be counseling. It could be consultation. And the use of what we would call reflections and summarizing the client's conversation helps them to hear back what they've just said, and also they hear it from a different perspective because it's coming from you. So reflections and summaries are a big part of this strategic response. And then there's a third area that research has just shown over the last 10 years, that there's a sequencing, maybe it's been 8 years, but there's a sequencing of preparatory change talk. And we call that looking at the person's desire to change, their perceived ability around the change process itself. What are some of the reasons that they feel are necessary related to change, and what are the needs? And hopefully getting from that desire to change into the need, which is the internal components that we're trying to get at. And the last part of that is commitment language. And that can be particularly troubling because we have a lot of people walk out of our offices or our clinics or whatever saying, oh, sure, I'll do that. I'm on board with that. Oh, thanks very much. But when they come back in for another problem, like, for instance, taking their hypertension medication, and if I feel good, why should I bother to take it? I'm not doing the medications the way I need to take them. I'm maybe not paying attention to the strategies that we talked about to kind of help me with my anxiety or with my thought processes, all those kinds of things. They'll look at you and say, you bet, I'm on board, and you check in with them later, and we oftentimes see that very little, if anything, has been done in some of our clients, and some of our most troubling clients, and those who have maybe some of the most complex problems. So we want to think about using this preparatory change talk to help us get a handle on what's going on for our clients in that arena of change. Now, the evidence base for motivational interviewing, there are two elements, engagement and retention. And engagement is simply what we understand and know about when a person is engaged in the change process. They are much more likely to continue in that. And then the piece about retention has to do with that when they're staying in that change process for a period of time, the likelihood of change is much higher based on the research that we have. So in the terms of the engagement, both parties, that's you and the other person, establish a helpful connection. Again, this helps us to set the stage for why we're working together and what we're going to do as a team, if you will, in the change process. Now, the retention piece is the whole idea of staying the course. We know that when that happens, we do have increased outcomes, and those increased outcomes, again, play out very well when it comes to change for all of us. Well, now I'm going to talk a little bit more about this. There's something a little bit more ethereal that I want to talk a bit about, and we call that the motivational interviewing spirit. And the spirit is we have some ideas around this piece of spirit about what we would like to see when there's a conversation using motivational interviewing. So there are 4 parts to this, and that is what we feel and know in terms of the research makes up this spirit piece. So the first thing I want to talk about definitely is the collaboration, and I've talked about that a little bit about how we're collaborating with the persons that we're working with for whatever their issue is. The next one is we would call that acceptance, and acceptance is you accepting where the patient is at any given time, that you have an acceptance of who they are and what's going on with them regardless of their issue. It's kind of like we don't really blame somebody who comes into the ER who's having a heart attack. We do everything that we can to save their life. And we do all the things that we can to help them afterward to do that. And there's no judgment around that. When they come in 2 or 3 or 4 times for heart attacks and they haven't changed their behavior, we might start to see some flashback from staff about that. We don't blame people when they have medical problems typically. And so it's this whole idea of accepting where the person is at, even when their change process is not where we would like it to be. Thirdly, we have this thing about evocation, which is evoking from the client, conversing with them, asking questions and reflecting back about the conversation and talking about the change process itself. What does it mean to them to make a change? The last one is the area of compassion, and the compassion piece has been described as basically as an altruistic piece that we will be giving something to the client. We see their struggle. We understand their struggle, even if we have not gone through it ourselves, but that our compassion has to do with, offering a helping hand and offering a way of helping them to understand that we are wanting to help them. So in essence, if you think about it, it's really all about the relationships that we have with people and making those relationships solid before we move along to provide our expertise and provide our experience and the knowledge that we have. So getting buy-in is critical, and I'll talk a little bit about that engaging process in just a bit. Now, the thing about this is that we have a lot of patterns around, again, what I was talking about earlier we call non-compliance. So we've got to figure out a way to solve that with folks so that they can be brought into their own care, that they can be engaged in it, and that we don't just keep telling them what to do and they just don't keep not doing it. And so the idea is that this collaboration is an important part and the basis or foundation of this motivational interviewing process. Now, we also have some definitions, if you will. I'm not going to go into the definitions that are the technical ones or the research ones, but I think these really help us to understand that motivational interviewing is a particular kind of conversation about change. You can call it counseling, or you can call it therapy, you can call it consultation, but it's really a method of communication that is again particular related to change itself. That is collaborative, again person-centered or partnership. Honoring the person's autonomy, and which is their freedom to make a choice whether they choose to do something or not. And again, we try to very much stay out of what we would call expert recipient role, in that we still use our expertise, but we are very strategic about how we use that and in what areas. The third one is that motivational interviewing has this evocative piece to it, and it's that evoking from the client in relationship to their particular issues around change, their concerns about it, and what they would like to move ahead with. So it's getting their commitment, if you will, about what's the next step or what they would like to achieve in the next part of the work that they do with you. Now, again, some of the foundations I'd like to go on. Up here I have a little icon, and many of you are probably familiar with this icon, and it's the icon of the stages of change. And so we do understand that change is a process, and that we know that motivational interviewing actually draws from what we call self-perception theory, and that is this whole idea of what did I just hear myself say. So self-perception theory is about how I see myself and how I'm listening to what I'm saying. We also want to make sure that there's a conversation about what are some of the pros and cons, if you will, about the change process. And our goal here really is to discuss change without incurring any damage to the relationship that you might have with that person. And that would be in regard to what we would say, put their defenses up. And why might their defenses go up? Well, it happens when we push, and we push around if they don't think that their status quo, there's anything wrong with it, then there's something that they might have to say about what we would recommend related to the status quo. So if we're recommending change, we better be having conversations about change with our patients and clients before we move ahead with that. So the connection to the stages of change model itself is great because there's a nice sequence of those changes. And what's interesting about that, in that it's not motivational interviewing when we're using stages of change, but what it does is helps us apply our motivational interviewing interventions related to where the person might be at in the change process. So if a person is in the early stages of change, we are very concerned about stepping too heavily into that. So we're very light, and we do things that will help the client or patient think about change itself. So using motivational interviewing in your practice, I want to just encourage you that it is a tool that anyone can use, and that people that have engagement in what we call this guiding style seem to have better outcomes. So we talk about motivational interviewing rather than being directive or rather than being a following kind of thing, is that we definitely have some guiding toward a specific direction for better outcomes. And that we try to, again, we're trying to kind of take a look at helping the client normalize their own behavior. Instead of looking at what might be happening in terms of other people's behavior, let's keep what the patient is doing at the norm and see where we can help them with that. So we also know by research that we definitely have admissions to hospitals and readmissions have changed with the use of this type of methodology in the practice. All right, so motivational interviewing actually uses 4 central processes that we talk about are the flow of the motivational interviewing conversation. So here I have them up for you. Engaging, again, the process of establishing a positive, helpful connection and working relationship. Focusing, that is the process of developing and maintaining conversation about change in the specific direction. Evoking, and that's the process of eliciting their own motivations for change. And planning, the process of developing commitment to change and formulating a concrete action plan. Now, we look at it in this piece, it looks kind of like this for us. It's kind of like a stair step. And if you think about it, you go up a stair and you go down a stair. So it's kind of like Shirley Temple dancing back and forth up and down the stairs a little bit in terms of this. So we try to look at it in steps. But the other thing we kind of look at it is that we really do understand that change is really a process. And really, when you think about how change happens, we all might have different ways of thinking about that. So in terms of this change being a process, we've looked at stages of change and how it may play a part in this. And that, again, we think about change might look like it if we don't look at the processes underneath it, because when somebody just quits smoking, when somebody just makes a change in something, and it looks to people on the outside like, well, they just did it. And, I always say if we're Nike and we can just do it, we wouldn't have the problems that we're having in terms of our health care and other behavioral health issues related to, a noncompliance, if you will. So when we understand about the lack of comfort that comes when change happens, because it's a new piece, and that it's rarely a linear kind of process. It definitely doesn't happen, again, like up and down the stairs, yes, but in a line, probably not. So I'm going to ask you to think about change for yourself for just a moment. And I'm asking you to write down somewhere, you can have a pen or pencil or just think in your head, got something, to answer these 2 questions about your own particular theory of change. What are your thoughts about how people change? And then what are the most successful strategies or change strategies that you use right now in the work that you are doing? So we're not going to have a report out or anything, but we are going to, I do want you to just take a minute or 2 just to think about your own practice and how people change and what you do to help them in that process. So I'm going to give you about a minute to just write that down, and then I'll come back on. Okay, so if we think about change, the process itself, it hopefully will engage us in the understanding that we have maybe a particular way of thinking about change because it's about how we change in our own world, about how we might be the initiators, if you will, of the change process, or somebody else might be the person or persons who are making us do this change. So people change in a variety of different ways, And again, we all, I think, in the helping professions have some successful strategies that we're using. And I would love to have you identify those, because you're knowing those and being able to identify your own theory about change are pretty powerful, because that's the kind of thing you're doing, and you're sharing that with your clients and patients when it comes to making the change process. So we understand, too, that there's a response continuum when it comes to the change process itself. And how many of us like to have someone shaking their finger in our face versus offering us something that might be more helpful when it comes to the change piece itself. So it's the idea of I'm telling you what to do versus I'm giving you something to consider and to make your own decision. And what we say about that is that it often avoids a pushback from the person. In other words, the defensiveness is not there when we are offering them a change or a menu of options for change related to, hey, you better get on board with this or you're going to go blind, or many of the other kinds of things that we might think of. People having, we think about people who have had struggles and difficulty and have been incarcerated. And, that's a kind of the hammer coming down on you. That's that outside kind of thing. And we hear a lot of times about how some of those folks, they have an internal change. They've come to think of things differently or think things differently when they have a lot of time on their hands. That's really not rehabilitation necessarily. But again, the whole idea of did I want to change myself versus somebody making me do it creates what we call a dissonance or a discord in the client themselves. Now, there's another thing I want to talk about in terms of this slide here called the writing reflex. And in this particular idea, we have to understand that as helpers in the field, whatever field you're in, healthcare, behavioral health care, that as helpers we kind of have an internal sense about making a difference. And in making that difference, a lot of times this writing reflex comes along and kind of pushes us from an internal stance. So for instance, when we see someone doing something that we know is going to be not so good for them or turn out badly, then we kind of find ourselves compelled, if you will, to say something about it. And it's that compulsion to write things is what I'm talking about here in terms of the writing reflex itself. So we often get in the middle of things too quickly, and that's something as helpers we want to watch for. And that doesn't mean that you don't save a child who's running out into the street now. You do. You definitely do. You definitely have to act if something's happening right away. But again, when it comes to many of these conversations about change, and we're discussing what would that change be about, many times we end up having more, I would say more, significance in the conversation than does the person. So we end up kind of, and I don't mean to, not necessarily preachy, but we end up telling people or directing them much more than they'll let us know that is comfortable for them. So this writing reflex happens when we have a desire to help and we're not really collaborating with the person. So it's this whole idea of you using this collaborative stance to resolve what we would call ambivalence. And ambivalence about change is the thing that really puts people in what I would call a stuck position, or I often use the terminology of their feet are in cement and they can't move because they feel stuck. And it's this ambivalence that really gets to us as helpers because we want to say, well, make a decision, or, all you have to do is this. And if you would only do that, it would be so much easier for you to see how change would be better in your life. Well, ambivalence really is a very powerful anti-change process that's going on inside a person, and oftentimes we don't see that because it's in their head and they're not talking about it. And I want you to think about something you've changed successfully in your life and think about how it may have been somebody else's bidding, or it was a difficult kind of thing. Change is usually not that easy to take on, especially when you're talking about a major change, about what all you have to do to reorganize your life around this change thing and how much focus you have to put into it. And sometimes we go into the change process not very happy about that. So in terms of ambivalence, it's this hesitancy that we all have, that humans have, again, and it's present within, again, this whole readiness realm of change. Where do I go, and what is it that I'm doing? And then the idea is that if we don't understand that a person might be ambivalent, we're not going to understand where they're coming from. So, again, going after change when a person is ambivalent is probably not going to end up with change for the most part. And again, we have to remember that this kind of change or this kind of ambivalence is not responding at all to any kind of logic. Again, we've done a lot of that, more sentencing, more, and more doesn't necessarily work when it comes to the change process. So we say it's about trust. It's about really having a great understanding of where the person is at, of why they're not moving ahead in the change process, and for whatever reason, and then establishing that trust before they may be willing to, and maybe it's to be trusted in themselves as well. So this is kind of what ambivalence feels like. You're caught between, you can't move because you're caught. And the whole idea behind this is because there's a psychological reactance. When a person, again, perceives that their freedom or they're being challenged or they're feeling pushed, their defenses go up. And they might want to really please you. They might really want to make the change. They might really want to do what it is. But unfortunately, what ends up happening is they get stuck. And they get stuck because, well, that ever-widening cliff, if you will, before they fall down or relapse, if you will. But, that cliff isn't that the gap between the cliff isn't so much at the very beginning of a relationship if there's trust. And a person can stand on their own 2 feet and make their own decision. But sometimes those decisions are pretty difficult to make. So we just want to try to avoid, if you will, pushing when a person is ambivalent. And recognition of that ambivalence is pretty important. So we don't want to push people into the whole idea of, if you tell me not to do it, it's a lot more attractive for me to do it. All right, and so the first process we talk about is engaging. Listening, again, empathizing with a person, understanding where they're coming from, even if we haven't been there. Again, we talk about this client-centered or person-centered type of style. And we use these ORs, which is, I'll talk a little bit about the ORs. The ORs is what we call a mnemonic, if you will. It stands for open-ended questions, affirmations, reflections, and summaries. And basically, we use this method of communication to help them look at both sides of their ambivalence or both sides of their dilemma. So as we try to help a person share a little bit about themselves, perhaps that gap begins to lessen between those cliffs, and the person's ability to stand on their own 2 feet comes back to them when we start having this discussion about change. And then, of course, we want to think about this writing reflex I was just talking about, or kind of staying away from fixing it for them. And sometimes we try to fix it a little too fast. So we talk about these areas of collaboration, respect, and acceptance about where the person is at. And, of course, that all adds up to the compassion of helping. So what gets in the way? Well, we sometimes have things that get in the way. What kinds of things might get in the way for the people that you are working with? And I'm also going to ask you to answer this question on your own, if you will, and just have you think about this for about a minute or two about what gets in the way when it comes to your clients' or patients' barriers to change. What's impacting, what is it that is at the crux of that? So I'm just going to ask you to think about that and perhaps write that down. All right, so you know that establishing or kind of trying to find out the barriers to change for our clients or patients, again, it's important. And it's important if you even think about it for yourself. What are the things that get in your way of making a change? Your way of doing things might be not the same way that somebody else does it. And you may be, again, reacting if you haven't made that change in yourself. So our clients react the very same way. Again, when we think about human behavior, we want to have, and in particular, our culture, the culture in the American culture is very much I'll do it myself kind of culture. We don't see that in some other cultures in that they are more what we call pluralistic in helping each other and asking for help and those kinds of things. But there's a lot of people in our American culture that it have to do with I'll do it myself, thank you very much. So I like to say that the job of motivational interviewing is really to keep the conversation going. And let's kind of try to stay away from thinking about it's my job to motivate somebody else, because we are just not the people who can do that. We can prepare, we can help, we can listen, but the ultimate piece is that the decision is going to be that person's. So again, the job of motivational interviewing is to keep our conversation going, and that we know that motivation doesn't last. So again, neither do baths. That's why we suggest them daily. So we have to think about motivation as a property that is not just I'm motivated or I'm not motivated. We have to think about it in terms of the idea related to that. Let's check in from time to time about where a person might be at with motivation. So the next process we look at is focusing. And this focusing piece has to do with kind of deciding what we would call a target behavior. And the target behavior would be something that, again, you want to work on. So it's not about motivation or about being motivated or not. It might be, am I motivated to stop drinking alcohol and not motivated to continue using marijuana? Or am I motivated, yes, I would like to lose weight, but I don't want to give up my ice cream in the evenings. So again, it's that whole idea of getting a target behavior and making sure that we find out how important it is for that person to make a change related to that. And again, the target behavior is usually something in which the person is struggling. So it's ambivalence that's at the heart of not changing. And we use a strategy in MI called agenda setting, trying to find out what's important and what's important in particular to that person and where they would necessarily be willing to go when it comes to the change process. The other thing is that it's really important for us to be transparent about what we're after. And, you know, if the client is on board with additional kinds of things, that's great. But we really have to say what we're after. What are we trying to do? So if I'm working in a diabetes clinic or I'm working with an HIV/AIDS client who is particularly having some behaviors that are endangering them, I'm not going to just tell them, well, here's what I know you can do to change that. I kind of have to find out how it's important to them, but that, yes, I am in the business to help you with this issue, and that's where my expertise lies. So we don't want to throw away your expertise, but we want to use it strategically with this focusing piece. So again, the idea would be is that you're going to what we call avoid. Whoops, I'm trying to get this evoking piece up here. Sorry about that. So our next one is evoking. And evoking means that we're really trying to think about and draw out the person's internal reasons for change. What are their ideas around the change process? You know, I work with a lot of people who have difficulty with change, and they say, well, I've tried everything, and I just can't do it. So I'm not going to try. I'm just going to give up. And that happens to a lot of people because they lose their confidence. So our job really is to help them and draw them out in terms of this confidence piece and help them try to understand a little bit about how maybe change can happen in a different way for them, and that their reaction to this might be pretty normal when you feel like you're a failure. So we try to draw out ideas and reasons for what we call importance about change for these folks, and to also make sure that we stay on board with what's important for them, because that could change during the time that we're working with the client. So we would do a thing called listening for change talk, and change talk is anything that moves the client forward, and sustained talk is all these things that keep the client where they're at. We do a lot of things in evoking about summarizing the change talk. So our directional focus is not to give equal precedence to sustained talk and change talk. We give more precedence to the change talk itself. And that we're always being very respectful to the client related to advice, because we always want to make sure that we're asking permission, that we only offer advice after we've found out what's going on with the client, what their ideas are, and what ideas we might collaborate on in how to change that. So we use this strategy here related to, I was talking about this earlier, the ORs, but we avoid the expert trap. We stay away from this trap that we are the experts, we are the only ones who know what to do, and we are the ones who have the answers. Well, in some sense, that's probably true because of our expertise and our training and goals, all of that. But we really want to use that strategically so that the person comes up with their own arguments for change. Now, the conversation or core conversational strategies we talk about are the 4 early strategies, and we call them ORs. And it's just a mnemonic. Sometimes we show a boat with oars in it, but again, open-ended questions. Why? Because they get us farther when it comes to a conversation. Our conversations are much more depthful with open-ended questions. So you're going to ask questions. And I'm not saying closed-ended questions are not a good thing. I'm just saying that we try to typically use more open-ended questions than closed-ended questions, such as the yes or no kind of thing. Did you, do you, will you, versus what, how, consider these things. So we're using open-ended questions to help us get information and evoke information from the client, get them talking. Affirming. And this is a very powerful tool. This tool actually really helps us to not patronize the client or patient, but again, help them understand that we are really appreciative of the work that they will do with us, and affirming them in what they might have not done anything, but if they show up in your office or in your clinic, something's going on that we need to be affirming because they are actually there. Reflective listening, and this is what Mill Miller, or the author of Motivational Interviewing, and Stephen Rolnick would call the backbone of motivational interviewing. So we do a lot of training around reflective listening and how to do it correctly, and how to get very deep into a conversation related to these reflections. And the last one is summarizing. And summarizing is pulling things together, kind of like a bouquet, if you will, for the client. Putting things all together for them, and then moving on in terms of their what needs to happen for the change process. So we talk about this helps us move toward eliciting positive change talk. So we're using our ORs to do that. And again, we look at this as a tool to guide them toward that. And again, it's a guiding strategy, not a I'm going to tell you what to do type of strategy. So in short then, what we want to do with our motivational interventions is we try not to argue or be pushy with our persons that we're working with. We try to show that we understand their perspective, and also that it's important for us to be optimistic, supportive, and hopeful in regard to what's moving on with them. And then the other thing that is really important, and we talk about this is developing discrepancy, is we try to explore the inconsistencies between the person's problem behavior and what their goals and values are. In other words, their goal might be to be a healthy person, but their behavior might not be following that goal. So we try to look at that and see where we can come up with any inconsistencies. And we try to have a discussion about those inconsistencies, not as though we're pointing them out and bringing them up to push the client in any way, but that we are paying attention to them. Excuse me. Now, the last piece is called planning, and this is often called the bridge to change, in where we try to get consolidating commitment here. We're trying to work with folks to get them to the place where they will make a commitment after they've been on board with the engaging, the targeting, and the evoking. That we ask them key questions to determine what their readiness for action planning is, and that we try to assist them with those change plans. And we try to revisit those change plans from time to time, because when we do that, we can find out what barriers might be interfering with the ability of that person to actually keep up with the change process. So as I wrap this up, I'd like you to be thinking perhaps about different questions. We're going to leave about 5 minutes at the end for questions here. And I just want to say what the basics are that we're looking for. So it's a focus on behavior change. We're really going to make sure that motivational interviewing is not just a conversation, a nice conversation with a nice person about nice things. We have a focus, and the focus is that behavior change because we're trying to impact outcomes. That, again, this motivational interviewing style or spirit is a very important component of this, that the way we speak, the way we act, our nonverbals as well as our verbals are really important in our acceptance, if you will, of a person and where they're at. Asking open-ended questions. This is, I'll probably give you some examples of those kinds of things at our next webinar. But again, asking open-ended questions. How do we do that? What are some really good ones? And how do we help ourselves get that to be one of our practices, if you will? Affirming strengths and change efforts that the person has had in the past. How have they shown that they are motivated, and maybe they haven't made great headway, but how is it they're showing that they're interested in that? Making reflective statements back to the client, helping the client hear back what they've given to you is a very powerful tool in motivational interviewing. And then hopefully fostering this collaborative atmosphere of autonomy and what we call personal choice. And then, of course, practicing the strategies, practicing them, doing them on a regular basis with our clients, having our clients somewhat teach us, if you will, how to do motivational interviewing itself. So with that, I'd like to wrap up. It's about 5 minutes to 12, and we want to leave some time for questions. So I know you've been listening to me the whole time, but I want to thank you very much for participating in this webinar today.